right, we're back with Steve Edmonds of Alliance Insurance Services and Catherine Sevier with AARP, and we're talking all things Medicare and health insurance related. Catherine, this person says, once you have Medicare, is it required that you go to the doctor for a well visit, or is it optional? If it's required, what happens if I don't go?
It is not required. The well visit is a gift that they give you that they will pay for on a regular basis. Not really a gift. It is an annual opportunity to be checked up, but you do not have to go.
Okay. This person says, my Medicare medical insurance premium exceeds 10% of my monthly benefit before deductions. Can I get some assistance with this, or does the $164 apply despite my monthly benefit? Steve?
Yeah, it's possible assistance on it. When a person is on Medicare, there's a couple of things. One is called LIS, which is low income subsidy. And so some folks can get that. That helps pay insurance premiums, and it also can help pay prescription drug costs. And there's also specialized insurance programs for people that are low income. And these are called DSNPs, as in dual need. And that means a lot of times when you're on Medicaid and Medicare at the same time, there's specialized plans that you can get enrolled with that will help you as well by lowering your deductibles, lowering your copays, and lowering your out-of-pocket maximums per year.
Okay. Catherine, this person says, are the premiums for Medicare based on household income if you're married and filing jointly, or individual income? I'm wondering if it would benefit me to file separately if I'm married.
I think that's something where you've got to look at your tax returns, because they are based on last year's tax return, and then when the new premium comes out, you will get a letter saying what you have to pay. So you might, if you have an accountant or you work with your taxes, look at it then and see if it will meet a different criteria.
Okay, this person says, I took Social Security payments excuse me, at age 62. Does that mean I'm going to automatically be enrolled in Medicare before I turn 65? Steve?
Yeah, most of the time, if you start drawing your Social Security at 62 and a half or 63 or 64, you're automatically enrolled in Medicare. You'll get your card in the mail without doing anything. But I would pause on that. You know, never say never. I would always check on it just to be 100% sure, because it's such an important date, and you don't want to let that date go by, and you don't want to incur penalties on it. So always check it out. But likely, yes, you will automatically be enrolled, but I would take the extra step and the extra 10, 15, 20 minutes and call and make sure as well.
Right, because you don't want that penalty. All right, Catherine, this person says, do you really need to get an Advantage or supplement plan? And if so, why or why not?
So the reason you get an Advantage or a supplement plan is Medicare does not cover all of the services that you need 100%. So a supplement or Medicare Advantage are both two different strategies for helping you to cover the entire cost of your care. They do it differently, but they're very important for really managing your coverage, and especially things like drug coverage, because without drug coverage, you can pay an awful lot out of pocket.
Okay. Steve, this person says, our daughter has been on our health insurance policy. She turns 26 in December. What options should she be looking for health insurance, and when should she start looking for them?
I would start probably 2 months before she turns 26. So probably in October, she needs to start investigating this. Now, as far as what she needs to do, that's going to be dependent upon her situation. Number one, is she working? Does she have an income? Or number two, does she not have an income? So that's going to depend largely on what we would recommend for her. But I would start a couple of months ahead of time, and there should be good options for her, and relatively inexpensive options at age 26.
All right, a lot of this is confusing. I know, Catherine, AARP has a tool to help folks with this.
They do. They do. And it's on the AARP.org site. And I think we normally show it, but if you go on that site and query income tax, Medicare, it'll be there. Sorry.
All right. Yep, we're showing it right now. Folks have it. All right. Thank you for your time and your expertise, both of you. Now, if you at home missed any of this information, you're going to be able to find it on our website, WFNYnews2.com. It will be in the 2 Wants to Know section.